Okay, before you go to the patient room, you have to ready your equipment. Make sure you need to label your tubing. Okay, if you need to do CBC, then you go to the patient chart, get the label. Okay, and then make sure before you draw the patient, you have to match it's the right patient. Okay, from the ID band and the patient identification, two identifiers. Okay, so if you're gonna draw a CBC, probably you just need about 3 to 4 ml. Okay, when drawing blood, you need your tube. Okay, you need a needle right here and a syringe. Okay, and you need 2 empty syringes. Okay, why do you need 2 empty syringes? Because the first one is to waste the blood. Because imagine the patient is running normal, let's say normal saline or TPN. So if you're gonna draw it directly from there, then basically it's just gonna be the solution. Okay, that's why you need 2 empty syringes and then 1 saline flush. Okay, so and then your needle and an alcohol pad. Okay, so when you go in there, you have your label, you identify the patient, and now you're gonna tell the patient that you're gonna draw blood. Okay, so when you draw blood, usually we use the middle port, but it depends. You can just use either the proximal distal or the medial. Okay, so now if you have something running in your medial or proximal, then you can just use the distal port. So wipe the port with alcohol for 15 seconds. Okay, and then you don't have to clamp it. Okay, because you have a cap. But if you want to remove the cup and change it later on, because as much as possible, because this is blood, especially you cannot see it, unless you have the clear one, then you don't need to get another cap. Okay, let's say we're gonna use the clear one. Okay, so now I have my empty syringe. Okay, I cleaned it already, and now I'm gonna put it in and then withdraw. Let's say at least 5 to 6 ml. Okay, and this is gonna go to the waste. Okay, this is gonna go to the waste, and then you have your for the CBC, your specimen. Do I need to clean it again? No, because you just cleaned it. Okay. Okay, I need about 4. Okay, this is 4, and then hold it. Don't put it here, because once you put it here, then you're gonna be confused if this is the waste or your specimen. So hold it, okay, and now flush it. That's why you need to have your flush. Okay, then flush 10 ml, or if you need more, especially with the clear caps that you have, you can see if there is more blood right there. If there is more blood, then get another saline flush and then flush it again.
Until you don't see blood.
Until you, because once that blood is clotted, then it can be a thrombus later on. Okay, and then after that one, after flushing it, get an alcohol pad and then clean it again. Why? Because the site can have, you know, a blood product right there. Okay, so now since you already drew blood, you have your blood here, then you get your needle and then put it on the specimen bottle right there. Okay, and then okay, now hold it, get a biohazard bag and then send it to the lab. Okay, questions? Nope. Okay,
The
we're
blood
moving.
that you take out, you just put it in the waste, like in the trash can?
No, not on the trash can. On your biohazard.
Biohazard.
Yeah, biohazard, yeah. Okay, usually we have a red bag right there for your biohazard, not on a regular trash can. Okay, so that's how you draw blood. And then make sure, don't leave this one like on the nurse's station or on the table. Okay, and then make sure before you draw it, you already have your patient identifier, and then you verify it with your patient. Okay, questions?
Do we, after we flush with normal saline, we don't have to flush with heparin, right? Unless
No.
it's doctor's order.
Yeah, unless it's a doctor's order. Okay? Questions? And then if you have, like let's say you're running a normal saline you're running a TPN, so make sure you put all those medication on hold, okay? If it's a vasopressor or if it's a vasodilator that you're running, do you have to put it on hold? No. Because once you put it on hold, then in 5 minutes, what's gonna happen to your blood pressure? It's gonna drop, okay? Unless it's contraindicated, so hold it. If it's just normal saline and the patient is getting it at 100 ml an hour, then you can hold it for about 5 minutes while you're drawing the blood. But then if it's a vasopressor or vasodilator, then don't hold it. Okay? Questions? Nope? Okay, removal.